Patients who present with facial paralysis often have several concerns about their appearance and smile. First, they tend to have asymmetrical facial appearance where the right and left side of their face are different depending on the type of paralysis that they have. They tend to have issues with their eyes, forehead, and obviously, most importantly, with their smile. Patients also with major paralysis tend to have difficulty with articulation, difficulty speaking, difficulty with their speech, as well as chewing. So as a result, the goals of facial reanimation fall into several categories, the most important of which is the functional issues. If the individual's eyes do not close properly, we need to make sure that immediately those issues are managed by taping of the eyes shut, using a lot of lubrication in the evening and throughout the day, and artificial tears. If the eyes are not protected in that manner, an individual can get scarring of their cornea and could potentially get blind. For individuals who have drooling or poor articulation, we want to address those issues with improvement of the corner and the position of the corner of the mouth. And most importantly, we want to achieve an improved symmetry and smile for the patients. The smile that we can generate and we want to address, ideally we want it to be spontaneous, because if someone needs to think about their smile, they tend to not use it, because smiling is an emotional movement. It's not something that people think about. As a result, I generally tend to recommend treatments that spontaneously improve one's smile. The most common treatment that we do for spontaneous improvement of the smile is a selective neurolysis. That usually is done in patients who have had some regeneration of their nerve and have synkinesis or asymmetric movement of their face. For individuals who have no movement to their face at all, we tend to recommend a cross-facial nerve graft with a gracilis flap. What a cross-face nerve graft is essentially, we get a nerve graft and we secure that nerve to the normal facial nerve on the opposite side of the paralysis. Then a few months later, we bring in a small muscle from the inner thigh, it's a gracilis muscle, and sew the nerve of that muscle to the cross-facial nerve graft. This way, the muscle that we've brought in gets activated by the normal side. So when you're smiling, the normal facial nerve will help the paralyzed side move and smile. So these are our main goals with facial reanimation, but every individual needs to be identified, treated, and we like to create a customized pathway for every individual.